an abandoned house, and we don't know how long it's gonna be till the zombies find us.
Everyone, our families have been killed or turned into zombies.
It's okay.
The government doesn't care about us, man.
They don't
They
care.
didn't give the people what they needed, universal health care, and to protect against this monstrous disease.
Guys, it's up to us to fight for the social injustice.
Yes, we fight it.
That's right, Bismarck. It's up to us to lay the foundation for a new healthcare system so this never happens again.
It can never happen again.
Right.
Okay, let's go, guys.
What are we gonna do? You guys! Oh my God!
You said it, coming. You said it, coming.
This is crazy! What are we gonna do? We need to make a health insurance policy that the future generations can follow. It's up to us.
And be proud.
Yeah, we need reform. So, how are we gonna start this?
So someday someone's probably gonna find this, and you guys are gonna want to know who we are.
My name's Taiwan. On the streets, they call me Taiwan.
My name's Bismarck, but on the streets they call me Biz.
My name's Beverage, but in the streets they call me Beb.
My name is Ula Kingston. I don't live on the streets, but they still call me UK.
I'm Japan and they call me J-Pan.
So we need to make sure that everyone is covered, like regardless of their, socioeconomic status, or there needs to be equality in healthcare. No one should have to worry about being covered, guys. Like, no one should have to worry about turning into a freaking zombie.
Kind of like a nurturing parent. Reminds me of my parents, so loving and kind, and took care and responsibility of me until they turned into flesh-eating zombies.
Right, Japan, we should have a government that takes care of its peoples and takes responsibility and adds to the social welfare of its constituents. We need to have equality and we need to have human moral rights, and that ensures taking care of everyone.
Healthcare is a human right.
Yes, it is.
Unity needs to be at the heart of our healthcare.
Yeah.
Americans are one people, and regardless of where we came from, we all need to be taken care of.
Yes.
And stand together under the same treatment.
Yes.
That's right.
Yeah, and the price of treatment for this disease was outrageous.
It's
The
ridiculous.
amount of people that had to file for bankruptcy, it was criminal.
Mm-hmm.
There needs to be set prices, guys. There wasn't before, but today, medical treatment has to be
Set prices.
affordable.
Yeah. Set
Yes.
prices. They can't just do whatever they want with the prices.
Mm-hmm.
Not just treatment, but also pharmaceuticals.
Yeah.
They all have to be fair.
Mm-hmm.
They're all people.
Yep, definitely. And I think, maybe the government should be like the single payer. And everyone will pay in with their taxes, so everyone kind of, may pay a little bit different based on their income, but it'll kind of go into this funnel, and there'll be this health bureau, like another branch of the government, and, the government will pay for all of the public hospitals, all of the GPs, the maintenance and everything, and then it's kind of like an individual mandate. You can't opt out of it or anything. But
If you have a job, right?
yeah, if you have a job,
Yeah, you can't
you're
opt out of
paying-
it.
Even like taxes on things.
Yeah,
you're paying
yeah.
into the system.
Mhm.
Right. Even though we have universal health care, people are still paying their way in. It's not a free ride.
Mm-hmm.
It's a bit individualistic.
Yeah, because people who have jobs, they're going to have to pay their taxes.
Right.
And so they're going to have to pay their fair share. Everyone's going to have
Right.
to collaborate and work together. in that.
Right, and take
Yeah.
care of one another.
Honestly, the American dream could potentially be stifled because of everyone's trying to pay for these medical bills and to pay for these diseases. They're going to have so much debt, and that
Yeah.
could stifle the American dream because if people are in debt, then obviously they can't reach material accumulation, and
Yeah.
that's what we set out to do. We want to build a home, build our families, and be secure, and that shouldn't be stopped because we want to stay alive and we want to be healthy. That's just
healthy.
not exactly
Healthcare.
Yeah,
Right.
obviously,
Yeah,
right?
of course.
And so anyways, for people who are homeless and who don't have jobs, they're still covered through the Bureau of Health Insurance.
Yeah.
So
Yeah.
so they won't have a roadblock. Like if you lose your job or whatever, you can still get health care, like no duh, right?
Yeah, you
Okay.
shouldn't have to worry about that.
I
It's
think so.
ridiculous.
Yeah.
Adding on
Right?
to what you said is basic coverage should include GP, mental, vision, dental, x-ray, drugs, surgery, female
Exception, yes. Sorry, thank you.
Yes, thank you. That's a great idea.
Outpatient treatment, house calls, everything.
Yes.
Mhm.
Yes. Awesome.
I think so.
I can't believe mental hasn't even been covered. It's ridiculous.
I know.
Yeah.
You know, general practitioners can provide extra services as well if they open a private practice. You know, those luxury services for those willing to pay, and that way it gives into our capitalist American ways.
Yeah, people love to make money. But if they do decide that they want to open a private practice, then I don't think the government should pay for their building and stuff.
Yeah.
Right. They're able to make a profit, so they should.
Yeah.
They would
They
have
can
to
maintain
They
their
can pay
own.
they pay their salary, but any surplus, but not the building itself. They wouldn't make money for that.
The government should be more concerned about the health of its constituents instead of trying to make a profit.
Yes.
So we've come into a society that cares more about accumulating wealth and being greedy instead of taking care of its people. And that's not the kind of government that I want to see for the future.
No, that's why everyone's
Yeah.
a zombie, and that's why we're the last people.
It's a
in
choice
here.
Yes.
between life and death. I mean,
Yeah.
come on, is it really that hard to choose?
Yeah,
Mhm.
it shouldn't be.
Also, it covers everything except cosmetics.
Yeah.
Things that people want for looks,
Mhm.
that should not be covered.
Mhm.
Things like supplemental treatment, privatized care is necessary. However, GPs,
They should determine it, right?
yeah, they should decide whether
Yeah.
it's needed or not. For example,
Yeah.
if you need to go to the spa for stress relief or anything like that, they should decide if you need that or not.
Yeah.
That's preventative
Especially
care.
if they can't take medication.
Right, exactly.
So they have
Allergic to
like,
medication.
different options. for them.
Holistic
Like
remedies
say-
instead of.
Like say you have depression and you can't have any other treatment besides, say there's this like
Puppy therapy or something.
Yeah.
Like who knows?
So you're gonna
Yeah.
stress relief.
Yeah, and you
Yeah.
get your money's
Yeah.
worth out in the way that you can,
Mhm,
right? You're gonna
exactly.
get care.
Yeah.
You can receive coverage outside the holistic basic coverage. GP will be the gatekeeper. for
Yeah,
that.
that's
So
so
it will
important.
keep costs down
Yeah.
Mhm.
rather
Because if
than
you-
increasing.
Oh yeah. Because people go all the time. If you're like, you can go whenever.
Yeah.
You gotta keep that down.
Right.
Genius chick.
What?
No.
Smart card. Yes.
You guys.
Wait. So what is that gonna be then?
So like, it'll be a card, and it has our admin costs are ridiculous.
Mhm.
So you put all of the information, all the medical records,
Yep.
everything on this
Everything,
card, and they can
everything.
just take it.
And then it also tracks down the limit, like how many times people go into the for treatment,
okay.
Mhm.
and we should limit it to like 5 times a month.
Well, that's if you don't need the treatment, right?
Of course,
If
of course.
you're just abusing the.
Yes.
Wait, hold on. So we're gonna have a limit of you can go to what 5 times a month?
Like any.
Checkups,
Like any
checkups,
of
X-rays, whatever you
Oh,
need,
okay.
whatever health care that you need,
Mhm.
you can only visit
5 times.
5 times.
Well, I mean,
5 times?
not
5 times.
not like a limit. Not like you can't go more.
Yeah, but
If
But
you let
if-
something
yes.
happen.
Well, no, because what happens when you go over?
when you go over 5, then
Someone will.
from the bureau will come and check up on things and make sure they're not abusing the system.
Yeah.
Pretty much.
Make sure it's
Okay.
legit.
It's
like,
legit
if you have a
reason.
reason.
Then
They're not
5
just
times
crying
a
wolf, right?
Exactly.
Yeah.
Okay,
Yeah.
then 5 times a month sounds good.
Okay.
All right, cool.
Yeah. Cool. Awesome.
So doctors should get paid bonuses for keeping their patients healthy, preventative care, things like that. You know? Because, I mean, they'll be paying a little more up front, but then in the end, they'll be saving lives because less people will be sick.
Mhm.
You
Makes
know?
sense.
I think that's practical.
Yes,
Yeah.
right.
What else, you guys?
What else could we?
Oh, the percentage of our GDP that we were spending on healthcare was so high. Like, there's no reason that it should be that high, right? So we could maybe, even like a couple of the percentages that we use to fund the military, we could just, funnel that into the healthcare bureau instead. That would give us so much more money to work with. And I mean, we have a lot of cost-saving methods. We're doing gatekeepers, and we have the smart card, and then only limiting, the amount of times they can visit. And these will totally keep costs down. And we could maybe, I'd love to see GDP at like 10%.
Okay.
10% would be awesome.
I think it would
I
be
agree.
great.
Yeah. Okay. I agree.
And if there's a surplus of money, then we can lower the taxes for the next year.
Yeah.
Yeah, I'm totally on board with
People
that.
love that.
Oh,
Yeah.
yes.
and lower prices and everything. I think that's a wonderful plan. Everything that we're saying is practical and it's reasonable.
Wait. What are we gonna call this?
We need to
I was
have
just thinking about that.
yeah. We need to have something that they'll remember us by in the future.
But if it doesn't have a
If it
name,
doesn't have a name, no one's gonna catch on.
It
So
should be the superheroes.
the superheroes.
Really?
really? No.
What about the revival?
The
The
revival.
revival.
How about the like, oh hey, let's never have a zombie apocalypse again because there's no universal healthcare coverage and
Oh
this
sure,
government
like everybody's
sucks
gonna
ass.
remember that.
That's way too long.
Yeah.
That's way
Yeah.
too. I like the zombie apocalypse. Whoa, what?
I'm trying to care. I'm
I'm
trying
trying
to
to
plan.
So, what about Genius Chip?
No.
No.
Genius.
Come on, J-Pan, what is it? What's the answer?
The Guardian Healthcare.
Guardian Health?
Okay.
Guardian Healthcare.
Guardian Healthcare.
Guardian Healthcare.
I like it.
Yes.
Okay. Wait, I think. Are we
We
done?
came up with a name.
Is that it?
I think that's it, you guys.
Do you guys think this could actually work?
It's going
This
to
healthcare
work.
plan,
It
it's
has
gonna
to
work.
work.
Yeah.
It
We
will.
did it.
We
It
did. We did.
Yes.
I know we don't have much time, but this is it, guys.
Let
Let Guardian Healthcare be the future. So we're gonna put this in here, and hopefully someone someday will find this and let this be the foundation of healthcare in the future.
Yes.
That's all we can do.
Hope for the best.
Go take this somewhere safe.
Hurry back!
Hurry.
Before the zombies get in.
Guys, they're coming. They're coming.
Oh my God! Under the table!
Under. Ow! Oh. Okay, pause it.
We don't have much time, guys. But at least we had healthcare reform. They're coming!
We have been debating health care for decades. It has now been debated for a year. It is in your hands. It is time to pass health care reform for America.